is CGTN, China Global Television Network.
COVID-19 has projected itself not just as a deadly disease, but also a very powerful disruptive force across all spheres of our lives. Its social impact is beginning to take on a new trajectory in the family unit and broader society by exploiting existing weaknesses and creating new ones. Cases of deviant behavior such as underage drinking, drug abuse, gender-based violence and child pregnancies have been reported to be on the rise across various parts of the world. So what is this perhaps overlooked impact that COVID-19 is having on the social order? And are COVID-19 response plans factoring in mental health and coping mechanisms? I'm Beatrice Marshall. Welcome to Talk Africa. Three months into Kenya's first reported case of COVID-19, at least 152,000 teenage girls were reported to have acquired pregnancies. This represented a 40% monthly increase according to the United Nations. Was there a link to the COVID-19 pandemic? The United Nations Development Fund also says that gender-based violence increases during every type of emergency, whether economic, conflict or a disease outbreak like COVID-19. And indeed, in April this year, South Africa's Police Minister Becky Cele announced that at least 2,230 gender-based violence cases had been reported during the first week of the country's national lockdown, 30% more than the same dates in the previous year. In June, the Centers for Disease Control reported 40% of adults in the United States struggled with mental health or substance abuse. This is also linked to the COVID-19 pandemic. Many more cases of such disruptions have emerged in the era of COVID-19. But what are the long-term effects on society? We are now joined by an expert panel of guests to help us explore this subject. Joining us via Zoom from Nairobi, Dr. Muthoni Maathai. She's a psychiatrist and senior lecturer at the University of Nairobi's Department of Psychiatry. And also joining us via Zoom from Johannesburg is Bafana Khumalo, Director of Strategic Partnerships at Sonke Gender Justice. Professor David Dickinson, Professor of Sociology at the University of Witwatersrand, is also joining us from our studios in Johannesburg, South Africa. Thank you all for joining us on the program today. Now, the world has been on a lockdown for much of 2020 due to the outbreak of the coronavirus. It has had devastating public health consequences, but this has been much more than just a public health crisis. It is also a human, economic and social crisis. Professor Dickinson, let me start off with getting your thoughts here. What has been the extent of disruption to the social order? How has that disruption manifested itself?
Thank you. As you say, it's a complex question, and clearly there's been a public health issue, something that we've not dealt with in living memory at this scale. But I think you're right. With hindsight, or at least looking back from the current situation, certainly in South Africa, the economic impact of the lockdown has probably been more disruptive, in my view, than the virus itself, although it's very hard to distinguish sometimes. And I think, again, in the South African context, we start from a base of mass unemployment and a whole array of social problems stemming from the past and, of course, present policies as well, which the virus, has, of course, has impacted in, and we can talk much more about that. But I think maybe it's not so much the disease itself, but it's our social structures and our ability to operate as a cohesive society that have really been tested and perhaps have not come out too well during the current epidemic.
All right. Dr. Maathai, the social fabric in South Africa, we've heard, has been severely tested, but it has also showed us that, the interconnectivity that holds society is very complex and very significant. Everyone has had to adapt to a new normal. Psychologically, though, how are people coping today?
Okay, To start off with, the situation we find ourselves in is unprecedented in many ways. For in mental health, we have always propagated the idea of social connectivity, interpersonal relationships, and we have in fact not encouraged people to even have social physical contact. So this has all, of course, been disrupted, and for some people this has been very difficult and continues to be very difficult. That loss of physical contact, more so, of course, the young people and the elderly. It's been very difficult for our elderly parents to accept that we are not going to be with them. For the young people, that they're not going to be with their friends, and so um, we may not have exact studies at the moment, but
Right.
there seem to be indications that there has been an increase in the levels of depression. Uh, um, of course, anxiety has been high. People became very anxious about getting infected, about being locked into spaces, about not being able to move, and
Right.
and the fear of the unknown has hit everybody. We don't we are all learning from the beginning what this means to us. So it definitely has had a very big psychological impact on people at all age groups, actually, including those children who have missed out on their friends, who don't have to go to school anymore because they can't go to school. And even when they open schools, for those who are there, the fear follows them. So it's been
So,
big.
so
It's a
we're
big,
going to look at,
devastating, yeah.
that psychological impact on students in just a moment. But Bafana Humalo, let me get your thoughts here, because beyond the health and the human toll, which social groups, in your view, have been particularly affected today?
COVID has obviously impacted uh, uh, on women particularly and children. Um, Women have been confronted, of course, by lack of economic opportunities, because what COVID has done, it has demonstrated the levels of poverty that is confronting our communities. And as we all know, when there is no food in the home, it's usually the mother or the woman in the house who has to scramble to try and find something to put on the table. Now, with all the lockdowns that were, put to bear, it's been difficult to even, scramble around to try and find something to eat, and this has been a problem, and it has played itself in a number of ways in terms of violence that has been visited on women and young people, particularly during this time.
Dr. Mathai, let's explore that violence angle a little bit, because you and Secretary General Antonio Guterres himself mentioned that recently when he called for action to combat a worldwide surge in domestic violence. Has there been a link between a surge in domestic violence and the restrictions put upon as a result of the pandemic?
Yes. There's been a lot of reports of increasing domestic violence, violence against children and even adolescents, and against parents, I mean partners. That means intimate partner violence. The reason for this is, of course, with the lockdowns, people find themselves confined in sometimes extremely small spaces, and then there are all the fears that go along with the COVID and the lockdown, loss of jobs, loss of income, which make people irritable, anxious, and they are likely to break out into violence uh, for very small provocation. So mothers who don't know, like the previous speaker said, who don't know how they're going to continue feeding their children because they're not able to make an income, uh, they are likely to become aggressive towards their children because they are anxious themselves and they are irritable. Partners who are anxious So these are some of the areas. Anxiety is one, being confined in small spaces and being afraid of the future. Children have been spending a lot of time in schools, and this gives parents opportunities also to go out and work, and also to you know, the amount of time they're together gives them time also to kind of relax. When you have many children and they're all surrounding you, this one wants that, this one, and they can't go out, and you can't go out.
All right. So, Dr. Mathai, this is also really bringing into question the whole role and responsibility of schools beyond just a normal school environment, because, you know, there are a lot of questions as to what is going to happen to children once they return to school. Countries have lost a whole academic year. We've got students who have not been able to join the e-learning programs, particularly in many places across Africa. What is going to happen to these children? What is the harm that has been done to them psychologically as a result of that confinement and as a result of the lack of that social cohesion with other students?
Well, one, I wouldn't say harm done to them, but the harm they may have experienced, because really a lot of governments in the world did not have options. They're trying to protect their populations, you know, from a very situation that nobody quite understood. So some went to extremes, not because they were, but because we didn't all know what was going on. So they have experienced harm in the sense that they've lost on school. Some of them have experienced another side of their parents, the aggressive side. Some have experienced being cut off from their friends. And some have become very, very used to social media or the internet as a way of communicating. These are things that they will have to get out of. But I think we must also remember that children are very resilient. And the schools should not be, the child should not be made to adapt to a school, but the school should adapt to a child.
Right.
The school is there for the child. So the schools have to, and the teacher and the curriculums, they have to adapt to the child. They should not make the child to fit the box, but the box has to change.
Professor Dickinson, let me get your thoughts here, because you know, a report from the UN recently talked about a regression, particularly of the progress, not only economically, but also the social progress towards achievement of the SDGs. What is the aspect of social progress that you think is going to be severely affected, Professor Dickinson, that is going to be severely affected as a result of the pandemic?
Let me answer that, but could I just come back to the point about domestic violence? And I think it's important to understand how the lockdown has operated or not operated. And I'm speaking from South Africa, so I can't say for other countries. But to be honest, the lockdown has only really been observed in certain parts of society. Middle-class people able to work from home, state institutions, schools to some extent. But to the vast majority of the population, we have to accept the lockdown hardly exists. The precautions are not being taken, people are not isolated. So I think that's important to understand, because if we say there's been a change in domestic violence, we need to know on what basis that's happening. So I just wanted to emphasize, which I think Mr. Khumalo did talk about, the economic impact of the lockdown is what's, if there is an increase in gender violence, and of course in South Africa this is an incredible level of violence, pandemic or no pandemic. We know there's over 100 women are raped every day. So, but we need to actually understand the realities of the lockdown and not pretend that the regulations correspond to the reality of lived social lives in the townships and so on, the townships being where the majority of the population, urban population, live. So I just wanted to say that, and I think it's important that we do discuss the realities and versus the regulations. In terms of development goals, a very important question. It's clearly set us back. And I'm going to give the example of the metro rail system here in South Africa.
Right.
In the large urban areas, the cheapest form of transport for the working class is the metro rail systems. Now, the authorities that run the metro rail, it's a state-owned operation, plagued with corruption, inefficiencies. They withdrew the security guards because of contractual issues prior to the lockdown. The metro rail systems have been completely stripped. It's absolutely staggering if you go into the stations and see what's been done to them in terms of all the infrastructure has been stolen, down to the rails even. Now, obviously, that has an enormous impact on when we trying to get workers to work. They now have to use the minibus taxis, which are up to 4 times more expensive. So this has a further impact. And I'm going to finish now, but I just wanted to say what it reveals is the lack of social cohesion in South Africa. Because if we were a cohesive society, we would have protected our infrastructure from such destruction.
Well, we'll take a short break now, but do stay tuned. The conversation continues on COVID-19's impact on social order. We'll be right back.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Welcome back to Talk Africa. Still with us from Nairobi, Dr. Muthoni Maathai. In Johannesburg, Bafana Kumalo and Professor David Dickinson. Let's continue with our discussion. Bafana, let me get your thoughts. Which aspects of the societal fabric are you finding or are people finding the most challenging to adapt to as a result of the pandemic?
The economic situation has really hit everyone very hard. And in a sense has also exposed, the differences between the haves and the have-nots in our communities. Majority of those that are in the lower rung of economic activity has been hard hit. People have lost jobs. People have had to take, half pay cuts in many instances. People are relying on government social welfare programs, which are not adequately run. I mean, they are useful and good, but not always run efficiently. And so it has accentuated a lot of the problems that have been under the surface in our continent particularly. And then this plays itself out in, dysfunctions like social fabric in terms of violence. You have high levels of teenage pregnancies that is reported across the continent. The United Nations actually reported a few weeks ago that, gender-based violence multiplied 3 times during the lockdown period, which means, people who are confined in a space where they are, having to, in a way, negotiate space with a perpetrator. We're finding it difficult because if you are not even allowed to go out, there's no reprieve to even leave the house and find something to do in the meantime. And so the levels of violence has increased quite tremendously. And we also see a lot of alcohol abuse that has been playing itself out because of the depression that arises also because of this situation.
All right. Your thoughts, though, because, the measures that governments have undertaken, particularly the physical distancing and the disruption that this has caused to social activities, cities and villages and society in general is going to be quite difficult, quite different. What does the future hold, though? What do you see in the future for cities, for towns, for villages, for society in general? How is it going to look like?
Well, I'm going to dissent from some of the views expressed. I actually don't think that the epidemic is going to create a seismic rupture in society. I think when the vaccine is in place, by and large, we will actually try and go back to normal. There'll be some exceptions to that. Dr. McKay, I would quite agree with her in terms of that it's going to push the use of communication technologies. And I think that's a good thing in terms of ecological issues. We don't need to travel so much and so on. We can communicate using these technologies. But that will be limited to the elites of global elites that have access to that. I agree with Bafana Kumalo around how the epidemic has and will continue to exacerbate inequalities. Those families with resources, their children's education has continued throughout the year using these new technologies. That's not been the case for the vast majority of the population, the working class, the unemployed, and so on. So I think that there are issues that we can pick up that will be different. But to argue that somehow things will change fundamentally, I actually don't see that happening, but we'll obviously find out. But I do want to come back to this point that we have to be appreciative actually what's happening on the ground. Those that are in confined spaces, in South Africa at least, responding to the lockdown are basically the middle class, whose confined spaces are not that confined by definition because they have better housing and so on. If you go into the township streets, the children are playing in the streets just as they always have. The lockdown has been largely ignored. Nevertheless, they've been deprived of schooling and so on. But what I want to point out, you know, as social scientists, all of us have to have our feet on the ground, our eyes on the ground, as well as following what we're supposed to be doing according to government regulations.
Dr. Mathai, the full scale of societal disruption is just emerging. We don't know, you know, what the long term or, you know, the immediate short term and the long term is going to look like. So what risk do you see COVID-19 having on society, particularly in the long term?
Yeah, in my opinion, society is not really going to be the same again. I mean, there has been a huge crack, and this crack has opened out. And of course, there has also opportunities for other ways of thinking and other ways of approach. It is going to change in ways that we do not quite understand. One of the ways that I see that changes coming in is that people are going to rely more on the internet for working, for communication. People will rely more on the internet for education. We've used the platform a lot. That will not all go away, and also for access to global programs. So there are some positive things that are going to happen with this. There are also some other issues which have come up, is that the level of mental illness has, of course, gone up. In our setting, there is more awareness. It has increased the awareness about mental health, and it has even raised the status of mental well-being as an important thing to be considered. So in a way, that it has changed us, and it has changed society, and our reliance on physical and social contact may actually go down, and that is not always that is negative in a way, in many ways, but there may be, we have to look for the opportunities that have opened up. But I really don't think there will not be the norm of yesterday, of 2019.
Right.
Whatever norm is coming will be it's a new norm. We'll have to define that norm.
So there is going to be a new norm, Dr. Mathai, and of course there's got to be some interventions, you know, to address with some of the societal challenges that are going to come about as a result of the new norm. What do you foresee as the role of governments or families over associations, such as yours, for instance?
Yeah. I can talk about what we're doing in mental health at the moment, and we are really exploring telemedicine, for example, particularly also because access to mental health care in this country or in Africa actually, sub-Saharan Africa, has been very, very inadequate. Most people are not able to access. And we've been exploring mHealth, and we found that we have projects which were doing face-to-face interventions, face-to-face assessments, and we find that we're able to actually train people to do telephone assessment. We're able to actually train people to even do interventions with groups using their phones. So for us, it has also brought in that opportunities to explore other ways of reducing what we call the mental health gap, the treatment gap, which has been very, very wide, meaning that a lot of people are not able to access mental health care.
Right.
And they're reducing it. So that for us, I talk for mental health, that for us is now the future. We're going to be accessing more people, maybe not face-to-face. We're going to be training more people on the ground and without actually the cost of face-to-face training. So that is where I see some opportunities and some directions. Things are going to happen, and they will not happen the way they used to do, but we're going to improve them. There's
All right.
opportunities for governments to really link into this.
Professor Dickinson, you have the final word on this. Your thoughts?
Thank you. I really wanted to pick up on Bafana Kamalo's point about there'll be more epidemics, and I absolutely agree with him. Where I think I disagree is that our response has to be deeper than building health systems and so on. These epidemics are fundamentally a result of our war on nature. We are simply expanding our human population, the pollution of the planet, pushing against the natural habitats of animals, and therefore we're getting zoonosis, the increased zoonosis, I should say, the transfer of diseases. And we actually have to bring about far more fundamental changes around how we live in harmony on the planet in an ecological balance, because the technological fixes that our huge technological advantages have created over the last centuries are not going to deal with the way that we're impacting on this very fragile planet, which is the only inhabitable planet that we know of.
All right, we're going to leave it there this week on the program, but thank you to my guests for their insights on this complex subject. In Nairobi, Dr. Muthoni Mathai, a psychiatrist and senior lecturer at the University of Nairobi. In Johannesburg, Bafana Kumalo, Director of Strategic Partnerships at Sonke Gender Justice, and Professor David Dickinson, Professor of Sociology at the University of Witwatersrand in Johannesburg. Remember, you can follow this and more conversations through our social media handles on Twitter, Facebook, and YouTube. And be sure to catch us again next week on Talk Africa. From me, Beatrice Marshall, it's goodbye.